Surrogacy, the last option where you will get your baby. If your womb is not good, if your womb is having so many fibroids, if your womb is having previous infection and all the adhesions are present in the endometrial cavity, if the endometrium is very thin, it is not growing properly, if the blood supply is not good, not growing properly, if there is any Asherman syndrome where it has got affected long back with TB, if there is no uterus, sometimes uterus will be removed because of so many problems. Sometimes the uterus will not form whenever the female born, maybe due to fallopian tube, maybe due to Mullerian tract development. Maybe sometimes fallopian tubes will be absent, sometimes uterus also will be very thin, sometimes the uterus also will be having bicornuvate and there are two cavities. There are so many other problems. Suppose if IVF cycle is a failure, 3 to 4 times IVF or ICSI cycle is a failure, there is no other option for them. You select a good surrogate mother. We can take your egg, we can take your husband's spermatozoa, we prepare the embryo and we put your embryo into your own relative, own person's womb. Recently India has banned commercial surrogacy. Why it has banned commercial surrogacy procedures? Because there will be so many problems. Foreigners are coming because it is the cheap here. Foreigners are coming, only one single parent is coming and they are getting the surrogacy procedure done here and they are taking the baby, and what they are doing with the baby there we don't know. Nobody knows. And they are taking the egg donation here. They are not getting the female partner. Many people in the metro cities like Delhi and Mumbai or whatever, wherever it is, they are doing all the procedures, and sometimes the foreigners may be having HIV or hepatitis B infection, then only they are transferring embryo to the mother. Sometimes these mothers are surrogate mothers are getting affected, and every pregnancy is very, very precious pregnancy, and every pregnancy is actually every mother is also very important. So many times because of so many infection, because of so many other problems, and because of increase in blood pressure, hypertension, and there are so many other liver problems and all the things, the surrogate mothers who is acting as the surrogate mother, that is the third party, they are having so many problems, maybe up to the level of death. That is the reason now with all these problems they are banned surrogacy, commercial surrogacy. Because these mothers also should be provided by doctors for all the like insurance procedures. The insurance sometimes they are not doing all the insurance and all. Sometimes they are having so many other problems. Sometimes they are having the recurrent abortion. The health is getting spoiled for the surrogate mothers. So all these things are happening. That is the reason, because of the few other problems, this surrogacy procedure has been banned for the foreigners. And they have given certain norms, like if the mother is from 20 years to 50 years and the father should be around 25 to 55 years age, and then we can do surrogacy procedure, and they have to get their own people, own person, and they have to take care of the mother, surrogate mother by their own. All these things, they are again the bill has been passed in Lok Sabha. So that is the reason. Actually, surrogacy procedure, it has become little different. Previously, we used to arrange some of the surrogate mothers through agencies, and we used to keep them and we used to maintain them, and then all the commercial surrogacy procedures we were doing. But now the bill has been passed, so that is the reason we cannot do. But even then, you select a proper person on your own, and the person should be in between 25 to 35 years of age, the surrogate mother, and she should be healthy, and she should have had previous very normal children, 1 or 2 children, and they should be delivered by normal vaginal delivery, not like cesarean section is not recommended. And the mother should be, I think it should be better if you keep the mother throughout the procedure until delivery, and you should give them the good food and everything, and you should take care of the mother, and then usually maybe 1 cycle, maybe 2 cycles, maybe 3 cycles, she will definitely conceive. If the mother is not very good, 2 cycles, if you see the surrogate mother is not conceiving, you have to opt the other mother, you have to bring your own relative of the others, and this is only for the this is for the procedure only, like we will do it for only Indians. So these are certain things, and you can get up to 100% success. It may be assured also, because the fertile surrogate mother's womb is very, very good, and if your embryo is very good, then we will keep the embryo, we will do the embryo transfer, and we will send the mother to you along with you and the certain rest and certain good precautions you have to take to the mother, and you have to give good food, and you have to counsel her very properly, and because this may be your own sister or own niece or nephew, some of the related part of yours, so there won't be any problem in maintaining them. So that is the last option. Surrogacy is the last option. You can even sometimes, if suppose your egg is not good, and you can even go for egg donor and unknown egg donor or known egg donor and husband's spermatozoa, and you can go for surrogacy. And if the husband's spermatozoa is very, very, very problematic, or azoospermia or something, you can even take the egg from you, and sperm is the donated sperm, and you can go for surrogacy. Usually in surrogacy the result will be very, very good, and usually many people will get within 1 or 2 cycles, and sometimes it may go up to 3rd or 4th cycle, but maybe 1 to 2% they may not get, because so many cycles also they may not undergo. All these things will happen.